All right. Well, it's 30 of the hour, so you know what that means. It's Viva Lifetime. Ask Dr. Kelly O.M.D. And I am Dr. Kelly O.M.D., your board certified OBGYN and healthcare executive, here to help you live your healthiest and wealthiest life. We focus on 5 pillars: spiritual, physical, financial, mental, and emotional. And many of the things that we do are definitely focused exactly on that. So we have our podcast that post 5 days a week. We have a webinar that you are here for, and it happens on Mondays at 7:30 p.m. Eastern, 4:30 p.m. Pacific time, as well as we have something very special, and it's called the Affirmation Room. And that is when we get together once a month for 15 minutes, 3 nights out of the month, and we talk about what's on our mind. What are we affirming for our life? What are we calling forth? What are we letting go of? And what are we grateful for? When we do all of these things, it's called the Viva Life 5. We put that together with our meditation, our journaling, our exercise, optimizing our nutrition, and our sleep. And then we know that 95% of the chronic diseases and some of those acute ones will be reversed or eradicated. But it's not about Dr. Kelly O.M.D. tonight. It is about Dr. Robert Knight. He is here to tell us a little bit about himself, but then the top 3 things he wants us to take away. Dr. Knight, it's your floor.
Thank you, Dr. Kelly. Hello, everyone. I'm Dr. Knight. It's nice to be here with you all. I am a board-certified family physician, and I specialize in osteopathic neuromusculoskeletal medicine. So it's a lot of words, but we're going to be talking about what that is today. And the biggest 3 things I hope that you all take from this is, number 1, what a DO is. 2, what is osteopathic medicine? And then 3, what are some of the ways that osteopathic medicine may be right for you to try?
Thank you, thank you, thank you. So many of us know that we always start out with those top 3 things because we want you to know what is the bottom line up front. What are you taking away? But let me tell you how special Dr. Knight is. We both attended a community event where many of the doctors, and it was called Black Family Health. And many of the doctors from the community came there to volunteer our services and our education for our community members. He came up to me and he said, Dr. Elmore, tell me about yourself. We exchanged graces. And then he said, well, why don't you come to my new clinic? So Dr. Knight has gone away to get his education and came back home to help take care of his own community. And I think that is super special. So Dr. Knight, I want you to have this opportunity to tell us all about the top 3 things and let us ask you questions towards the end so we can learn even more. Dr. Knight?
Absolutely. So let's start from the top. So number 1, I'm an osteopathic physician, or a DO. And what I usually tell my patients is that from the beginning, there are 2 types of physicians in America, or 2 ways that lead to a medical practice. We have MDs and DOs. Both our training is largely equivalent. We both go through 4 years of medical school after graduation, and then 3+ years of residency in the given specialty of our choice. We can practice in all 50 states. We can go and practice into all specialties, from family medicine to pediatrics to surgery. But as a DO, we are also trained in what's called osteopathic manipulative medicine while we're in medical school. And what that is are a set of hands-on treatments that are actually really meant to help unlock the healing potential of the body. So we look at the body, we look at the person or the patient as a whole, and so we understand the relationships between structure and function, and see that relationship that almost every disease you can think of has a consequence on the body's musculoskeletal system. And when you address that side of it, that can lead to improvements in your body's natural healing, okay? So osteopathic treatment is very safe, gentle, and effective. What led me to this path was there were people in my personal life who suffered from chronic pain conditions that unfortunately weren't able to be helped as much by the medical system as we know it today. One of which is my Sifu from Kung Fu. So I spent a long time studying Kung Fu, martial arts. That led to a passion for me to understand natural healing and things like herbal medicines. And so the path of the osteopathic physician, when I learned about it, it just seemed like it was the perfect fit. And so my job, my passion, is to really help be that answer for as many people as I can who aren't able to get help trying medication, or maybe trying some of the other conventional forms, or even if they're told they have to live with the condition that they have. So I want to show them that there's another way, and to understand how mind, body, and spirit are connected to our bodies and our healing process. So a little bit about what I do. I see patients from all ages, from babies to adults. So when I see babies, usually it's for feeding issues or things like irregular head shape. And even though I do hands-on treatments, this is still a medical appointment. So all the history, all the medical diagnoses play a role in how I evaluate someone. So when I'm saying older adults, they can receive benefit from not just pain, but also improvement in mobility, improvement in other chronic conditions from everything from Parkinson's, irritable bowel, things like even asthma can show improvement with osteopathic treatment as well. So let me talk about some of the actual treatments and what they're like. Some of the treatments I do might look like massage, some look like gentle stretching, and rarely some of those techniques might resemble what people know as cracking, or kind of what chiropractors are known for. Even though there's many different forms of hands-on therapies and treatments out there, many of which you may have received, what makes us distinct is that medical training and diagnosis. And so my job is really to look at what is the root of this person's problem. And that's where things get kind of tricky. So, I specialize in understanding the biomechanics of the body. We're kind of looking at what does this person need in order to be healthy, not just today, but also going forward. So I often see patients with things like back pain and neck pain. And, most of the time, especially in modern society, we're not as aware as we should be about how much time we spend sitting, for example, or what our posture is like when we're at work. And those are just some of the things that we review on a mechanical level with my patients. So even if I treat you and I get everything moving nice and well, if you go back to work and if you're sitting out at your desk, your neck juts out, all that strain is going to come right back. So it's about kind of freeing up the areas that are tight, strengthening what is weak, but also cueing my patients in to remember, kind of keeping in mind what their posture is doing. When things get more complicated, it tends to be when we start thinking about or learning about things like trauma, or how does our mental state, how does emotion play a role into our body? And so one exercise I like to do with people to help them understand that mind and body connection, and everyone here can try this out, is very simple. So we're gonna take about 1 minute, maybe less, to do this. If you just kind of close your eyes, and take just 2 deep breaths, I want you to think about the most stressful day you can possibly think of. Traffic is horrible, the freeway shut down, maybe you're running late to work, or maybe you have a lot of children in the car that are all screaming and yelling. I know what that's like myself. But as you're kind of thinking about the most stressful thing you can, pay attention to what does it feel like in your body? What does it feel like around your chest? What's your breathing like? You might notice your chest feels a bit tighter. Your breathing is starting to pick up. And then some of the muscles around your neck are starting to tighten up. Okay. Now we're going to reset. So let that image go. And now we're going to do the opposite. Close your eyes and think about the happiest day of your life. What was that like for you? Maybe it was marriage to your spouse, birth of a child, your graduation day. And notice the difference of what that feels like in your body. People usually say that they feel lighter, warmer, like they can breathe. Okay. So now let's reset and come back. So going back to what I mentioned about how sometimes there's more than biomechanics at play, because if I am just treating someone using my hands-on techniques, but if I'm not aware of what their daily life is like, what things are like, what their job is, or what they may have been through, whether there's a physical or emotional trauma component, everything's going to come right back. And so what I love to do is teach people about this, and then they gain an all new awareness into their body and how they can prevent suffering from things like pain in the future. So I commonly teach breathing exercises for my patients, sometimes stretching and strengthening exercises as well. and we just monitor your progress. My goal is to help empower my patients so that they are able to maintain and keep this improvement going forward. So we kind of taper down on visits. I want them to be able to rely on their own health and not necessarily me. I love to see everyone who I do. I say I'm never going to tell you, you need to see me every week for the rest of your life. And sometimes people suffer from multiple chronic conditions, and they'll just be, we need to know, okay, what is your goal? What's the level of function that you want to achieve, and how can I best help you achieve that? So it really is a partnership, with the patients. And that's what I love about this field so much. An important distinction I want to make is that, I specialize in this. Every DO is trained in osteopathic medicine and in these principles from the start. So even when they're in medical school, they learn some of these basic treatments and some of these basic ways that mental state can affect the body, the way disease affects the musculoskeletal system, and whatever they choose to go into, whether they do radiology or whether they do pediatric medicine, they learn about the way that this plays a role in the body's healing process. So I always told my students, you're going to learn a lot of procedures during your training. You're going to do surgery, you're going to do circumcisions. I want you to know that you don't have to do O.M.D. I think that you can help a lot of people if you do, but I want you to understand its role in the disease process. And because that way you are going to come across someone who could benefit from it. And even if you're not the one doing it, you can send them to someone who who does.
I think that, first of all, doing that practice when you just took us to the stress and then the happy, joyful place. First of all, we haven't had anybody that ever did that. So thank you so much for doing that. And I was enjoying myself so much that I almost didn't come back to you. But tell us why that's so important. It to me, it feels like the body scan that I do first thing in the morning when I wake up. But tell us why that's so important. And VivaLife, just before you do that, VivaLifers, if you have questions that you want to start asking, please go ahead and either put your questions in the chat or raise your hand. So go ahead and get ready. Dr. Knight, why is that practice, like, what's the purpose of that practice and why is that so important?
So because let me put it this way. On a mechanical level, if you're sitting down in a chair for a while, let's say more than an hour, and let's say you know exactly how you need to sit, you have your workstation, your ergonomic workstation set up so everything is mechanically ideal, your laptop, your computer's level, feet are on the ground. At some point, if you're sitting for a while, your posture is going to slip. Or as you start to do things, you're going to be less aware of your posture. So you're starting to go back into that mechanical strain pattern. It works the same way with thoughts and stress. So even if you're kind of meditating or if you're doing all the work to strengthen your core, but there's a source of stress in your life that you're not as aware of how your body reacts to it, then we can do this work all day. But if you go back into that environment, all this starts to kind of creep back up again. Another thing I see a lot is people with headaches and migraines, and kind of going back to getting to the root cause approach. The amount of people I've diagnosed with TMJ issues with the joint of the jaw or with grinding and clenching their teeth at night, it's almost like 9 out of 10 times one of those ends up being a major factor into the role of the headache. So in a lot of times when we clench, it can often be stress related. So I can recommend wearing a bite splint like your dentist does. I can treat the person, but if I don't look for those other signs of it, then the healing process isn't as complete because the patient has to recognize what is going on. And they're not going to be perfect about it, but it's more about when you have an awareness of what your body is doing. That way, when you're in that situation, you can kind of stop, take a breath, and then reset yourself. Does that make sense?
Oh, absolutely. I mean, it sounds like one of those things where if we're not physically in your presence, then you've taught us something that we can do for ourselves so that we can de-stress ourselves in that moment.
Yes, exactly. So that's
And go ahead.
So that's really where the power that comes from. Even when I was in family medicine, I talked to my patients about healthy living and diet when they had hypertension and diabetes. It was the same concept. I said, it's not about being perfect. It's about where the small steps you can do to make a lasting change. So that way you kind of think a little bit more before you impulsively reaching for an item that might not be as good for you. But there's
Mhm.
going to be good days and bad days, but it's all about going on that track towards, what is the ideal I should be looking for? And that's where the slow improvement starts from.
Yes. Now, one of the things that you mentioned was Parkinson's, and
Yeah.
we know that Parkinson's is a neuromuscular degenerative disease. What are some of the things that you can help people with that have any type of neuromuscular disease like that?
Yes. So when it comes to any neuromuscular condition like Parkinson's or whether it's cerebral palsy, you have a disease process that's sort of starting within the central nervous system and it has an effect on the body's muscles and joints. But that process is progressive. Where my treatments come into play is number one, I can help sort of normalize the tone of the body within the patient's own health or healing capacity, but I can't force it to go back totally to normal. Right.
Hmm.
So it's about that's why every treatment is individual.
Right.
But in that process, you are optimizing tone, health, lymphatics, and breathing. For those who don't know, the lymphatic channels in your body are blood vessels essentially that carry inflammation away from areas that are inflamed. They deliver your white blood cells to your whole body to fight off infection. So, kind of helping to regulate that inflammatory process and that nervous process. But I can't say I can cure the process of Parkinson's with osteopathy. So, it becomes more about how can we help you maintain you're the most benefit we can get for the person. So working at musculoskeletal level, letting the muscles, those tissues kind of relax, balancing that autonomic tone, knowing that at some point things will progress. But we do have research that shows that Parkinson's patients can receive pain benefits in terms of decreased pain and improved mobility. So you're helping to improve the patient's quality of life for as long as you can. And
Hmm.
without that, and again, one of the things I love about osteopathy and why I chose it is because I always want one more tool I could use to help my patients. Because without that, we just have the medications, which the medications are excellent. They do help and they have their place. But what else can I do to help this person? In a much more straightforward example, even if I saw a patient with an upper respiratory infection, I had a tool I could use to help augment their healing ability by improving their breathing, working on their ribs, helping them fight that infection. Without that, I it was pretty much, you know, here's some Robitussin, drink fluids, and I sent them on their way. So having that extra tool set I found to be really useful. And the more I treated, the more I helped people, I realized that there's almost not really a condition in medicine that can't be helped by osteopathy or can't receive some type of benefit. So it's always worth it to try. Something a mentor of mine taught me.
I love that. I love that. And, another thing that comes up, and thank you so much for telling us about, what you can do with a certain disease type. Another thing that comes up, as you know, our membership is mainly women.
Mhm,
And so another thing that can come up is, and it can come over anybody, is cancers.
mhm,
So my clients know, and my Viva Lifers know that I've had a breast mass that's been evaluated and everything. But we have people in our membership and in our group that have been diagnosed with cancer or are currently concerned about a breast mass. So,
mhm.
can you tell me, on one hand, if you know a person that's had a mass and potentially even if it's benign, how do you adjust for that? And then also, if you have somebody that has a particular type of cancer and you're trying to help them with pain, numbness, tingling, like how do you assist with that?
Yes. So what I will say is that I don't necessarily want to use the word traditionally, but I would say when it comes to seeing a patient with cancer, there historically has been some concern when it comes to our treatments with if you treat someone, a patient with cancer, are you potentially making them worse? Because what we do helps to optimize lymphatics, to fight disease. So if certain treatments, are you potentially risking that cancer to spread or sending more blood flow to it and feeding it? The counter argument of that is because of our treatments are augmenting the immune system, is that you might also be helping to fight the cancer cells. So there has been some research today that we've done mostly in rats or mice. We haven't necessarily found evidence that it we're making the patients worse. But just given what we know about the mechanics of what we do, you want to know, your doctor's going to want to know if you have a cancer, where it is, what stage you're in. And that information just becomes important so that we are aware when we are doing a treatment, because that may very well inform my decision of, do I want to go right where that cancer is directly and treat? Me personally, probably not. But also, where else in the body do I need to be concerned about fragility? Like if someone has a prostate cancer that I know may be stage 4 or has spread, I need to know, has it spread to bone or not? Because there's increased bone fragility there. And even gentle techniques, there can be an increased risk of fracture if it's compromised by a cancer spread. So that information becomes vital in that sense. It's not to say we can't help them, but it's more about it would influence what areas of the body we choose to treat, or what areas of the body we choose to treat. Some we might treat more indirectly. So instead of going to like right where the cancer might be, like on the breast itself or into this axillary region, I might stay over on this side. Or deciding, hey, we don't have enough information here to where I feel comfortable, let's figure out if you haven't been staged yet, let's make sure you've had your PET scan, that we know what the cancer is and where it is. If you haven't started chemo yet, then maybe we should do it after you've actually started chemotherapy. And those are ongoing discussions with your physician. And that's why, especially now when we teach, we don't want our students to just think they have cancer as an immediate contraindication. No, but it does inform the way you think about the patient and how you adjust your treatment, as it always should. So it's not a yes or no, it's more about you need to know, have that information. If that information isn't there, it can wait. And that's the beauty of this, is that the osteopathic treatment can wait. If you don't feel like you have enough information to be comfortable progressing, wait till you have more information and then go from there.
And that's just so important, that it speaks to when I had my appointment or session with you, how much detail you went into my history.
Mhm.
Many times physicians take 5 to 7 minutes, and that's all you get, right? And you filled out a whole bunch of paperwork, and people wonder, did anybody read the paperwork? Are they looking over the paperwork? But you really do go deeply into, and you make that time to go deeply into, what is your medical history? What is your social history? What is your trauma history? Because all of these things can have effect on that. So speaking of, people with history of trauma, can you just kind of talk about, a little bit, what is your thought pattern when you are interviewing a patient or a client about trauma, and like, how does that affect their body when you're, going to give a treatment?
Yes. So one of the questions I have on my forms, and I'd be sure to talk about, is the trauma history. And, I do ask, has there been any history of trauma? I try to leave that part open, and I might ask some very specific things, because, for example, car accidents are common. But I usually ask, have you had any history of like physical trauma? And have you had any history of any emotional trauma or abuse, whether it's physical, sexual, or otherwise. And naturally, I don't always get that information on the first visit, for either maybe the patient isn't ready to share that information yet, or there might be things that they've forgotten about. But the reason why we need to talk about it is because of something that we call a somatoemotional release. So just as you've all experienced, mind and body are connected, right? So memories, for example, are connected to our bodies and the way that we feel. When someone has a significant, even aside from physical, emotional or abuse history, if you are treating them, when they are physically going into certain positions, that alone might re-trigger a memory or flashback of an event. And if you don't have that conversation with them and that happens and they don't know what's happening, it can be very distressing. So I always make sure we at least talk about that. And I let them know, when this is a safe space, if I am as we are working together, as I kind of move you into certain positions, or even when tissues start to release, sometimes those memories come up, or sometimes emotions get released with that. If that happens, it's okay. You're not going crazy. You're feeling whatever it is that you feel, by wanting to be prepared for that. And if it doesn't happen, then it doesn't happen. But I'd rather have that conversation than something happen and we explain it after the fact. And that's just a bit of what I've been taught and what I recommend when I'm teaching or when I'm with learners as well.
Yes, and I will tell y'all that Dr. Knight has a great bedside manner. And so when those conversations do come up, he really does take the time to understand the situation and the patient in their space and then provide that safe space. So I love that about you, Dr. Knight. So thank you so much for that. Now, one of the last things is, we have a couple of OBGYNs on here, right? Not just me, but a couple. So, what are some of the things that you're able to provide for a person that is, trying to get pregnant or maybe that is pregnant? What are some of the things that an OMT, like having the OMT, would be able to provide for someone in that situation?
Absolutely, yes. Pregnant patients are a great population that can benefit a lot from osteopathy for several reasons. One, there's all the mechanical factors associated with growing a human being. You have increased weight kind of coming in the front of your body that tilts the sacrum and pelvis forward and can cause a lot of low back strain, increased pressure on the pelvis itself. And then not only that, things like acid reflux from there being less room in the body and the stomach contents as that baby grows. So kind of going back to what are things that we can do. Number one, try and help normalize that fight or flight, that sympathetic and parasympathetic nervous system response. So kind of bringing those sympathetics down to allow for relaxation, allow for healing, trying to make sure the ribs don't get stuck so that they can still breathe as comfortably and mechanically as possible. And then relieve kind of the strain in those lower back muscles as they tighten or get strained, just to as the body is accommodating that growing baby. Beyond that, there is some benefit from addressing the body and then seeing if that has an improvement as the woman goes into delivery. So if the pelvic floor structures are tight or strained, or even if one bone is like really stuck and isn't moving like as properly as she moves or as she pushes, would that have a consequence as the baby comes out? It's pretty hard to do a study on that specifically, but kind of going with the idea of everything else we understand about the body and structure and function being related, we think that it does. So we, especially ones in fellowship, we were seeing pregnant patients periodically throughout the trimesters, but towards the end, we would see them sometimes weekly, up until the point of delivery. And then even afterwards, it can still play a role in helping with the healing process. Whether you've had tearing or even the birth was smooth, it's a lot to recover from, especially even in cases like C-sections, right? So and that just goes back to, again, those foundations of improving breathing, improving lymphatics. One of our more prominent osteopaths said at a lecture one time, inflammation essentially is a source of all good and all evil in the body. You need that inflammatory response to fight infection, to repair tissues. But when it keeps going and it's uncontrolled, then what happens? Well, we get things like, chronic scar formation, adhesions can start to form. I think anyone who suffers from, even outside of that, a chronic inflammatory condition, like things like rheumatoid arthritis or inflammatory bowel disease, there it's in the word, it's in the name, it's a chronic inflammatory condition. So kind of having some way to modify that to help kind of bring things more under control, that's where sort of the improvement can be seen. And that's sort of why that spreads out into all the other aspects of medicine as we see.
Yeah, I think that is so important because we talk about, chronic inflammation, chronic stress, which is, one of the ways that many people retain weight. And that's not just physical weight, but spiritual, mental, and emotional weights, which, bear them down, increase their risk of having chronic disease and acute disease as well. So I think that makes, a huge sense. And I'm sure our Viva Lifers can think about, okay, these are things that are going on in my body. And this is how OMT can actually help me. So that being said,
Also would say, even in the case of, this is sharing a personal story when when our daughter was born, and my wife ended up having to have a C-section, so again, after someone's had a surgery, surgery is, as one of my mentors put it, it's still a trauma to the body. It's a controlled form of trauma, but it's still a trauma to the body in and of itself. So your sympathetics are going to go haywire for a bit, and you can't be discharged. One of the ways you can't be discharged until you've had a bowel movement or until you've passed gas, because the physicians need to know that you've had return of bowel function after that procedure. So we have many studies showing that osteopathic treatment can lead to earlier discharge from the hospital because again, we can help normalize the nervous system. So I remember when my daughter was born, by the time she was actually out, I think my wife and I had probably been awake for 36 straight hours. And I was treating both her and my daughter pretty much immediately. And I think she ended up passing gas within 24 hours, which after a C-section, I'm sure Dr. Kelly, you can share, is not typical. So we were quite fortunate. At that point, we were clamoring to kind of get out of there. But yeah, I was able to get my wife out about at least 1 to 2 days early after that procedure. So we were very much glad to be home.
No, I think that's so important. And those are the types of things that people need to hear is, what is the impact
Mhm.
that this treatment, this therapy is going to have on you as far as your recovery from essentially anything that you're going through that causes a trauma or stress to your body.
Yes.
So thank you, Dr. Knight, for explaining us, what you do, who you are, where you come from.
Mhm.
Now we need to know, how do we get in touch with you? Because we might need to fly in to San Diego to see you, right? As well as make sure that the people in our community that are already here are able to utilize your services so that they can live their healthiest and wealthiest life.
Thank you. Yes. So you can get in touch with me a few ways. I do have my Instagram linked into the chat. So that would be at Night Osteopathic Healing. It's the same thing for Facebook as well. I do have also my personal email in the chat. If anyone ever has any questions, then it's more than fine to email me. I'm happy to talk about this, talk about calls. When it comes to my website, that's nighthealing.com, where you can see more information about osteopathic medicine, its history, more detailed information about the different conditions that I see, how it can help. If you're interested in scheduling, then you would have to please call our office at 858-587-1822. But again, I'm happy to answer any questions or talk with anyone before they come in.
Thank you so much. And thank you so much for coming back, not only to the community of San Diego, but now clearly nationally. And coming into the VivaLife Health Hub community, where we definitely focus on the 5 pillars: spiritually, physically, financially, mentally, and emotionally. We appreciate your time, both you as our speaker, as well as our VivaLifers. Please share this. My assistant is going to send out this information. It will be on YouTube as well as our social media channels, and we'll definitely tag you as well. So VivaLifers, you know how we do. We make sure we meditate, journal, exercise, optimize our nutrition, our hormones, and our sleep so that we can do it. Viva Life. All right, all right. Thank you for being a part of the VivaLife experience. I'm Dr. Kelly O.M.D, board certified OBGYN and healthcare executive. If you like what you heard, then please go ahead and like, share, and subscribe. The reason why is because we are trying to educate, encourage, and inspire 1 million people to live their healthiest and wealthiest life. And this is what we're bringing you. We're bringing you educational videos. We're bringing you podcasts. We are bringing you webinars with subject matter experts, including myself, about the topics that affect you the most. So go ahead, like, subscribe, and share. We are everywhere. Have a wonderful day. Viva Life.